So I'm going to go ahead and get started. My name is Karen Corman, and I have the privilege of being the Executive Director of the UIC Alumni Association. Thanks for joining us, and welcome to the UIC Alumni Exchange Series. Through Alumni Exchange, we work to bring you a variety of programs and topics so you can explore, connect, and even escape from the everyday with a community of UIC alumni, staff, and faculty experts. You'll hear me say this a few times today, but I encourage you to visit go.uic.edu/alumni exchange for the latest and greatest programming. And with that, I'm excited to start our program this afternoon. We are joined by Dr. P.S. Shridra, who is the Director of the Urban Transportation Center and the Director of the Metropolitan Transportation Support Initiative and a Research Associate Professor at UIC's College of Urban Planning and Public Affairs. Dr. Shiraji will be discussing the impact of COVID-19 on Chicago's public transportation system and the connection to the city and suburbs. Thank you, Dr. Shiraji, for being with us today, and I'll turn it over to you to begin the program.
Thank you, Karen, and thank you to the UIC Alumni Exchange for inviting us to talk a little bit about what we do at the Transportation Center, and more in particular, talk about something that's relevant given the times that we've been stuck in for the last year or so. Let me just quickly give you a brief peek about who I am and the Urban Transportation Center before I go through the canned set of slides. My name is Sriraj. As Karen mentioned, I have been at UIC and the Transportation Center for the better part of 21 years now, in various capacities, most recently being the director of the Transportation Center itself. Prior to that, I went to grad school a little bit south from here at UIC to Illinois Tech, as they call themselves now, Illinois Institute of Technology. Got my engineering degrees, transportation concentration, came over to UIC. And I've been here, been very fortunate to have worked on very many interesting projects during my time at the Transportation Center, which very coincidentally is celebrating it. So the Transportation Center was 21 years old when I joined it. And now we have grown. I am 21 at UIC. Transportation Center at UIC is 42. Great amount of work that had been going on prior to my arrival, and I've been fortunate to have been part of a great team, and I see many of my colleagues on the call, to have worked on many interesting topics. In particular, I've been fortunate to have worked on public transportation research as part of UIC's efforts in studying the transportation landscape, not just in the Chicago area, but also from the national perspective. So that's my background. That's the background about the Transportation Center. I see Ed Berry from the Transportation Center on the call here, and many of you have corresponded with him. Please do communicate with us as much as you want, as often as you want. So there's my shameless plug for the Transportation Center. Karen, apologies for springing that on you unannounced. But coming to the topic at hand, the outlook for transit in a post-pandemic Chicago. Thank you, Jessica, for advancing the slides. And what I want to do, and this is not necessarily fresh research that we've taken on, given the various issues with respect to starting new work during the pandemic, but what I'm going to share with you is a assimilation of work that we have pulled together for various purposes, including starting new research. And so that's what I'm going to use to walk you through what I think will be needed and what I think will be the future as it pertains to mobility and as it pertains to transit mobility. And if we can just scroll back a little bit to the previous slide, Jessica, and then this is the outline that I'm keeping in mind take a quick peek at why transit is important, look at some of the travel behavior trends over the last year, uh, how has the pandemic affected all of this, and why do we still need to worry about restoring public transportation? There lies a very rhetorical question: do we still need public transportation? So we'll dive into those aspects as well. Next slide. Thank you. So this has not been articulated very well, in my opinion. This is a major flaw with respect to transit and the industry in particular. Most people acknowledge that transit is very helpful for them, but I've not seen many different studies that have actually captured the true value of public transportation on society. There's been many anecdotal evidences at the transportation center. We in the early 2000s worked on the job access and reverse commute evaluation, which was a federal transportation program aimed at bridging the gap between homes and job locations for disadvantaged population groups. And then that study revealed there were at least many more dollars to every dollar that was invested in those transit services that were aimed at connecting people to their jobs or job training locations. So there's benefits to be had. So that is one of the isolated pieces of evidence that I'm speaking from. That's not generalized. So if you take highway transportation, there's a whole lot of work that's been done to quantify the benefits and the externalities of highway transportation or automobile transportation. But in the case of public transportation, this is just a very episodic foray into valuing the benefits. And the benefits have been acknowledged qualitatively, at least. There is definitely benefits to be had in improving access to the jobs that I mentioned. More recently, there's been a whole lot of literature coming from the intersection of health and transportation that talks about how access to healthcare is as important as getting the healthcare service itself in time. So, in case in point is many patients at the UIC hospital have uh, at least reflected that the reason that many of them tend to overstay at the hospital post discharge is because transportation is a barrier for them. And that tells you a little bit about how important transportation in general and public transportation in particular is for these people. The other aspect is access to fresh food and groceries, which also has been tied very coincidentally with the emerging literature on social determinants of health, that they also are very essential in establishing a good quality of life for individuals, especially in disadvantaged neighborhoods. And then so there's better health outcomes to be had, there's better mobility outcomes to be had, and most importantly, which gets acknowledged in the literature a lot, is it is a relief from congestion by allowing people to get to work and back home in reasonable time across all sections of the workforce. It's not just the transit dependent population that leans on the transit network. It's more a spectrum that ranges from less than 30,000 income to all the way to high six-figure income white collar job people. So it's definitely a recourse from being stuck in traffic. Those numbers are also to be quantified in a more elaborate manner, in my opinion. The American Public Transportation Association has done some work in that area in terms of quantifying the benefits, and have come back and said, you know what, for every dollar that you put into the public transportation system, you tend to get about $4 back in economic returns. That's a really powerful statement. It tells you a whole lot about the the importance of transit in our transportation landscape and also in our lives. And so then the question is, why is it not getting the due importance and acknowledged as such? So that is another aspect that we need to think about. Next slide, please. From the bigger perspective, which is the one that most of the literature that I've looked at talks about is it helps preserve equity. There have been questions about whether equity matters. What is equity? Is it the same as equality? And this audience probably knows the differences best, so I don't need to get into the weeds on that. But in particular, the mobility improvements are to be had for those who are transit dependent. And the way we define transit dependent population groups either are those that who cannot drive or cannot afford to drive. Those who cannot drive may be young, old, disabled, and then those who cannot afford to drive are the ones that are economically disadvantaged. And in a very, very curious case, during the peak of the pandemic, this whole transit service around the country, not just in the Chicago area, happened to become the lifeline for many of these low income, low wage workers that still did not have the flexibility of working from home and being on Zoom. They still had to be at their work locations. And then for most of them, transit was the main source of getting to their work and back home. And that was really borne out in some of the numbers, and then we'll talk about the numbers a little bit later. But that is also has underscored the importance of why transit is still relevant. Next slide, please. So the ridership impact by the numbers, and then this is not anything spectacular that I'm going to share with you. The focusing on the Chicago system, we have the three service boards um, under the aegis of the RTA, the CTA with its multiple rail lines and the several bus routes in the system, typically caters to several million rides per year. The number that you're seeing here, about 1.5 million rides each weekday before the pandemic. And eventually the numbers hit rock bottom to 30,000 daily riders during the pandemic, at the peak of the pandemic. And then there's been a rebound of sorts over the last several months, but it tells you a little bit about how impactful the pandemic was in altering travel behavior. Most trips that people tended to think was absolutely essential were foregone. There were other technological solutions that were put in play, including this medium that we are convened in. A whole lot of people gravitated to Zoom, and then life continued as usual for at least the majority of the population. There was still the core transit dependent audience. That's the number that you're seeing here, the 30,000 daily riders, were still dependent on public transportation. Next slide, please. And I pulled this from the CTA's latest published monthly report, and the CTA puts out a monthly report every month. And then the last one that I could find was for November 2020. And what it said was overall, there was about a 56% loss in ridership for the CTA on a year-to-year basis. So from Jan 2020 through November 2020, compared to Jan 2019 through November 2019, the same period, CTA had lost about 56% of its total ridership across bus and rail combined. But when you passed it further down, the rail reflected a more pronounced loss in ridership, 64.5% compared to the bus, which dipped by about 48%. And then the factors going into this are aplenty. Bus has always catered to a lower income profile of users compared to the rail, which typically caters to the white collar workers. And that is borne out in these numbers that we are looking at, because the drop in the bus ridership was not as pronounced, even though it was significant. It was not as pronounced as the rail. And not very surprisingly, the numbers that took the greatest hit were the weekday numbers. 62% on the bus side of things and 80% on the rail. That's the number that you saw on the previous slide as well. The weekend ridership, it took a hit, but there was not very any perceptible difference between Saturday and Sunday. 54% drop in ridership on the bus side, 72% drop on the rail side. But overall, it was gloom and doom across the board. One aspect that I want to reiterate here, CTA did not reduce its services. They did not cancel services because of the loss in ridership. They kept running the same schedule over and over again. And then I may want to just, because there we have audience from all around the country, and not many of them may be aware of what was happening here. The CTA, like many other transit systems around the country, capped the number of users, number of riders per vehicle at the peak of the pandemic to 15. And they indicated that they were not going to collect fares. At least until August, they did not collect fares. They were offering rides for free, 15 people per bus. All of them were asked to use the rear entrance of the bus. Main reason was that CTA operators, and this is a statistic that was revealed by the CTA president Dovell Carter, about 85% of the CTA operators have comorbidities that made them vulnerable to any exposure to people with COVID or being afflicted with COVID because of any passengers coming in close proximity to them. So it was a very conscious decision that was made by the agency to move. So the main reason why they didn't collect fares was because the fare instrument is located at the entrance to the bus, closer to the operator. They didn't want the users to come closer to the operator to pay the fare, so they forego their fare collection mechanisms and then provided rides for free. And because the capacity was constrained at 15, in very specific corridors where they saw more people waiting at the stops, they put more buses in place. So it was all around a Herculean effort on the part of not just the CTA, many other systems, including PACE, did similar things that they could within their resources to accommodate the demand that was more pronounced and more strongly evident in specific corridors, because not all across the service area do you see this type of phenomenon. There are specific pockets in the Chicago area that are transit dependent, are definitely going to be looking at the bus for their commuting purposes, even during the pandemic. And that's what the CTA ended up doing. Bottom line, they lost a whole bunch of revenue, and which we'll see later on as to how that came back to affect it. Moving on to the next slide. The other partner in crime here, as far as CTA, the PACE bus service, which operates predominantly in the suburban Chicago area on the collar counties and suburban Cook. Oops. PACE had a similar impact on their ridership, from 96,000 riders each weekday before the pandemic to roughly around 30,000. If you notice, the drop on the PACE side was less pronounced compared to the CTA numbers, which we said were about 80% for the weekday period. And that's mainly because PACE is operating a bus system. And as I mentioned, the bus typically caters to the lower income profile of users, which is what gets using the bus on a regular basis, even during the pandemic. So from that perspective, even with all of that, it was still a surprise for PACE that they were seeing so much loss in ridership during the peak. And so there's been some rebound. The numbers are not yet out for PACE as they have been out for CTA. So we're still monitoring that, see how that is evolving over time. Next slide. And the one that got hit the most, not very surprisingly, was Metra, the commuter rail. Went from 281,000 riders per weekday before the pandemic to hardly around 2,500 daily rides per weekday. That's a phenomenal drop. Metra did have to scale back on service. They had to cut down on the number of cars per train that they were running. There were a few things that operationally they had to do, but still it was such a shock to the system in terms of how these agencies were suffering. And one of the main things that helped out, and then we'll talk about the funding issue a little bit later, but there was definitely support from government to keep the transit system up and running. Next slide. So what does this all mean? We've seen that transit has benefits to offer. We've seen that the benefits have not yet been quantified to a great extent across the board in a meaningful manner. But at the same time, we've also acknowledged that the pandemic has wreaked havoc on transit ridership, especially in this region. And it's not any different from other large urban areas in the country. Most of them have been suffering through the same phenomenon. I was talking to a transit manager from San Francisco area, and their drop in ridership was along the lines of about 70% for the Bay Area rapid transit system, BART. And so every major metropolitan area, large urban center has gone through this upturn, if you will. And so what does this all mean? Let's dive in and see what this means. First off, I'm going to borrow from my colleagues at UIC who did stellar work during the peak of the pandemic, and they put out a survey of users, of travelers in the Chicago area. They collected about 5,000 responses. They're in the month of, I think it was in the month of April and May, right when the pandemic was raging at its peak. And they posed various questions about people's perception to travel, people's attitudes and mode choices. And I'm pulling out a few of the pieces from their work to showcase how all of this was reflecting on what we have seen thus far. Transit across all the modes. So they had a question about which of the modes do you think poses the most risk for you in terms of getting affected by COVID if you were to use that mode. And not very surprisingly, transit rated the highest. The categories was low risk, no risk at all, low risk, moderate risk, high risk, and extremely high risk. So you have 5 classifications of risk. And transit got 77%. So most of the respondents indicated that if they were to be using public transportation, they were putting themselves in either the extremely high risk category, which was 43%, and then 34% said high risk. So that's a very, very telling statement in terms of what the perception. And one of the most important things in all my years of studying transit is that perception matters. Perception is reality. If people perceive of transit as an inferior good, then they are going to shun it. If people perceive of transit as a very valuable commodity, then they are going to embrace it. And you see people on both sides of the spectrum, regardless of income, race, religion, gender, whatever you have it. Either you're passionately advocating for public transportation or you loathe it with a passion. There's no middle ground there. And so it's not very surprising, even for those that are dependent on transit. They were perceiving of transit to be posing a extremely high risk. And so that's something for transit agencies to listen to, which they did. When you look at it from the income profile, for those that were making less than $30,000 per year, most of them, 44%, were more likely to be temporarily laid off or lose their job if they didn't have the ability to travel to their job location. Even in those cases, because the establishment was going to close down, they were still in line to losing their livelihood. And in particular, restaurant workers and food service workers indicated that they were more likely to be in the category of likely to lose their jobs at 66% clip. So there's all around information about how the blue collar workers are affected, how they perceive of the threat during the pandemic of uh, contracting COVID and putting themselves and their health at jeopardy. So there needs to be some action from the transit industry. Next slide, please. So these numbers are still evolving, right? I mean, there's no confirmation that this is exactly what the end outcome is going to be looking like. Uh, there has been a rebound on the ridership front, as I mentioned. If you had looked at the CTA numbers from the peak of the pandemic in May 2020 to November 2020, there was at least a 20-point increase in overall ridership. But at the same time, because I said they lost revenue for two reasons. One, they lost ridership that resulted in loss of revenue. The second, because they were not collecting fares even from those that were traveling for a good 4 months, they still ended up losing more revenue from that aspect. And then the only way the industry survived last year was through the CARES Act. And they got for the first time in a long time. And then this may be common knowledge. So if I'm repeating and preaching to the choir here, forgive me for stating the obvious. But transit industry is heavily dependent on the state and local assistance for covering its operational expenses. The federal assistance typically comes for capital investment. So transit is such a unique industry. The capital dollars are earmarked, not to use a term that is not kosher, earmark in the sense that they are dedicated for investment into the infrastructure, not for paying your operators and maintaining your fleet. And that is expected to come from the state and locals, at least 50% of it in this region. The remaining 50% needs to be raised from the fare paying customer. Now you have a scenario where there is economic recession, the fare paying customers have dwindled down, and you're not collecting fares from a core of them. It's the perfect storm. So revenue dipped and bottomed out almost from the operational perspective, and there was no recourse from the state or local entities to provide for it. And for the first time in a long time, federal government saw the writing on the wall and they provided operating assistance to all transit systems. This region received a major shot in the arm, and that allowed for, I mentioned early on that CTA was running services without cutting them. That happened mainly because the federal government stepped in and provided that relief. So there was a huge bailout money that took care of the operational deficits. And they are getting another round for this year as well because the ridership has not rebounded yet. But beyond this year, that's a big question mark. If ridership does not rebound, if revenue doesn't trend upward, there is a scenario where cuts in public transportation will definitely have to happen. And we've seen those that are dependent on the bus, the blue collar workers, those that cannot drive or cannot afford to drive, the ones that are dependent and the ones that are making less wages, they are still dependent on public transportation. And so it is, at least from their perspective, it is very, very integral to keep transit running. And if you don't, then you're going to jeopardize the economic recovery of the nation as a whole. And then that's not necessarily a overstatement on my part. It is the true reality of it. There's going to be impacts to be had and consequences to suffer. Next slide, please. So, what's down the line? I don't know, but we'll see what the next slide says. The RTA has proposed a three-step plan, the 2021 budget that reflects on what is happening all around us, that takes into account the dip in ridership, the loss in revenue from the last year, and then what that may mean going into an uncertain future. So all of those are captured in the RTA budget for 2021. They also are talking about scenarios where there may have to be service cuts and what type of resources may be needed to sustain the existing services. And for the first time in a long time, there's an acknowledgement on the part of the transit industry that they need to reinvent themselves. This has been happening behind the scenes, but it's not been officially stated. And then for the first time, the pandemic, in a way, has provided that paradigm shift that the transit industry was looking for, to take a hard look at themselves. I always believe that as much as the situation forces you to change yourself, and you can point at others as to why you're suffering through certain things, you also have to be introspective about what else you can do on your own to improve upon the situation. And that's exactly what is happening with the transit industry right now. And the reasons for that are many. Next slide, please. And on the federal side, I did allude to the fact that there is going to be another shot of operational assistance coming through for this year. But going further into the future, very recently, there was this transit parity resolution proposed in December 2020 by the Transportation Caucus in U.S. Congress, headed by, I think, the congressman from Massachusetts, Chuy Garcia, CAPA's very own, MUP alum. And the intent of this transit parity resolution, as they labeled it, was to have equal seating at the table, if you will. 50-50 split in federal dollars between transit and highways. Now, will that happen? Just completely off the record? Maybe not. But it's a worthwhile venture just to bring it up. I think, as the saying goes, if you aim for the sky, you're likely to hit the mountaintop. So maybe if you ask for equal split, maybe you'll get 80-20 or 70-30. Still better than being very discretionary about it, because that's the current situation between how federal dollars are split amongst modes. Of course, there has to be, in my opinion, this is a totally personal opinion, is that instead of looking at modal silos, government ought to look at the transportation network as a system. Because that is what is going to, because all the literature in transportation currently is talking about mobility, not trip, not mode choice. It's about mobility. Mobility puts the focus back on the user. So if I can get to where I need to go using a combination of transportation options without having to worry about how I'll manage to do so in the most efficient manner in the fastest amount of time, that for me is the most important thing. If I need to get out of a train and jump onto a bus and then walk the last few paces to my work, that so be it. As long as you can make that easy for me and not make me think too hard about it. So if you want to improve mobility, then you need to look at the entire system in a very systemic manner, if you will, as opposed to the modal silo. So that's my, if you will, the spiel for the day. This is not set in any literature or any source material. This is just my own personal thought. So that's what government ought to be doing. We'll see how that they move that dialogue forward. There is a lot of activity about mobility management. Maybe there will be some action from that that will result in systemic viewing of transportation network. Next slide, please. So what are the agencies doing? That's the other question, right? I mean, we can ask federal government to intervene and support, but the agencies also, as I said, need to be introspective about where they are headed. Next slide. Um, so the agencies heard what was happening. The Chicago user survey that I mentioned, the 77% of the respondents to the survey in the Chicago area perceived that public transportation posed the extremely high risk for them to contract COVID. And then this was not isolated to Chicago alone. This was the same across the board, all over the country. And the American Public Transportation Association floated a survey of all transit systems that are part of APTA, and they asked them very pointed questions about what each of the agencies were doing in response to the pandemic in improving the perception of the public on the transit systems that they were dependent on. And not very surprisingly, and very surprisingly, almost 95% of the responding agencies to the survey indicated that they had doubled their budget for cleaning of vehicles and stations. They'd put in more resources to sanitizing their vehicles. They'd put in more personnel and resources towards addressing and making aware about the social distancing requirements and masking aspects. New York City, the MTA mandated that mask was needed to enter their system. And I believe the Chicago systems are also in following in the same manner. And so when you are entering the transit network, transit environment, you have to have mask on. So those kinds of messaging are being done. They had the capacity constraint that they put in place at the peak of the pandemic. They have relaxed it now. Hopefully, the vaccine will do its trick. If at all there is a vaccine and everyone gets access to it. Um, Next slide, please. Well, there is the money that is coming from the feds. This I mentioned about it just a little while ago. The $1.9 trillion relief package has about 30.5 billion for transit agencies across the country. And one aspect that, so this is a very, I thought I had this in factoid in there, but probably I forgot. The state of the infrastructure in public transportation, if I can put it mildly, it's abysmal. It's not any different from other transportation infrastructure in the country. The highways, the bridges, the transit network, all of them collectively get a very robust D minus from the American Society of Civil Engineers annual report card. Transit has a term that refers to the state of the infrastructure. It is called the state of the good repair. State of good repair means that you behave your age and you exhibit the tendencies of your age. So if you're 100-year-old asset and you are behaving like 100-year-old asset, then you are more or less in a state of good repair. I mean, that's the best you can do. If you've been maintaining, doing your annual physicals, taking care of your supplements, then you at 100, you will be like you should be at 100. If you've neglected all of it and if you've been lucky enough to get to 100, you may feel like you're 200. That's the analogy I can give as far as what state of good repair means. And the need for the country to improve the transit infrastructure because of this 30.5 billion number, I'm reminded of it. The need for the nation's transit assets is about $90 billion just for the state of good repair. There is also another aspect in asset management literature that talks about normal reinvestment. So if you have neglected taking care of your assets for the first 50 years of its life, and you've not done anything to upgrade them, You've not maintained them one bit. You've not, so take your automobile, for example. You've not changed the oil in your car for about 50,000 miles. And then all of a sudden you want to do regular maintenance. It's going to cost you something. But the 50,000 miles of backlog needs to be brought up to speed. And that is $89.5 billion or $90 billion for the country, not including any normal reinvestment that ought to be done on an annual basis. Bringing it back home to Chicago. The Chicago region, between CTA, Metra, and PACE, there is about $20 billion in backlog of state of good repair needs and another 17.7 billion in normal reinvestment backlog. So put those two together, the need for the Chicago transit system is $37.7 billion. That's billion as a B, not million, $billion. So compare that against this number that you're seeing, 30.5 billion for all transit systems around the country. It's a good gesture, but doesn't go a long way. Also includes 14 billion for airlines and $1.5 billion for Amtrak. All of them essential, but our focus is here about public transportation. Next slide, please. No, that's it. Okay. But the most important thing that needs to, I thought I had other things. Maybe this is an older version. There is a strong emerging competition from the shared mobility sector. If you look at the ridership profile for transit around the country, it was at 10 billion per rides per year in 2006. It peaked to 10.7 billion rides per year in 2014. And that was the golden period, in my opinion, between 2006 and 2014. But between 2014 and 17, transit lost 600 million rides per year. So it came crashing down to 10.1 billion rides per year in 2017. The last year I have numbers for. A lot of that has to be attributed to the emerging competition from the shared mobility providers. So the Uber, Lyft, shared bike queues, Divi in this region, e-scooter experiments, all of them are very unfortunately eating into the transit base. So transit has to figure out, this is the whole aspect that one of the slides talked about, the reinventing transit. Transit has to have a very hard look at itself and see if they need to compete or coexist. And the solution may be in the coexisting bucket. There are experiments, pilot studies being floated around the country where private operators are taking over service provision for small areas on an on-demand basis. With a 2-hour call-in notice, they can provide service based on a contract that they have entered into the transit industry for. So there's a whole lot of things that are happening in the transit sector that needs to be scaled up even further, even more. These are just the beginnings of what needs to happen at a larger scale. And so for that to happen, there has to be an institutional mindset. You need to have champions. You need to have younger, trained planners and engineers, the kind that Kappa produces, that go on to our transit industry and then make a name for themselves. I did see a couple of names that I recognized. I was immediately reminded. We are very proud of them. They have to do more of that. And then so we have to do more in supplying the industry with trained professionals that can take advantage of emerging data, new data sets, big data, technology solutions, and such, so that the industry mindset changes over time. So I'll stop right there, and then I'll open it up for any questions or comments. I did see a whole lot of comments, but I didn't want to get distracted from getting through to the finish line. Otherwise, I would have got the stern look from Karen.
Well, Dr. Shiraj, thank you so much. This has been such a wonderful presentation. And we do have several questions that have come in and a couple pre-questions. So let me start with, you mentioned that regarding the data, 77% of the public perceives that public transit is a high-risk activity. Do we know what the actual risk is? And this might be a public health type question too, versus other public activities.
Thank you for answering the question.
Well,
I
that's
mean,
when I read it.
to
I thought it was
borrow
more public health.
to borrow a line from Star Trek and dating myself, for God's sake, Jim, I'm just a doctor, right? You need a medical doctor to tell me exactly what the risks are. But definitely, in some of the medical experts I've talked to, if you are enforcing strict masking requirement, and if you're cleaning your vehicles, and then that's the most important thing. In fact, at one point in time, I was talking to a transit manager and advocating for them to bring a bus down Straight Street and put it right there and show how the cleaning is done. Because one of the things that agencies have been taking to more recently is cleaning with ultraviolet rays so that they can eradicate all kinds of germs in the vehicle. So now is as best of a time to get into a transit vehicle because it's been cleaned beyond belief. The one question about all of this is what happens once the bus leaves the garage in a clean and spiff manner? How much of a contamination gets happening along the route? And so that's the one issue. And if people really are aware and manage to keep themselves clean, I think it's going to be a non-issue in the coming months. And I know I danced around that question, but that's the best I could do with it.
Well, it's very complicated too, exactly to your point, as far as when they clean it and people get on and off transportation. Thank you for that answer.
Mhm.
Another question, do you have any idea if the recent transportation lockbox ballot initiative has any influence on funding for transit at the state level as the region moves to a post-pandemic future?
Again, a very, very complicated question. The simple answer would be yes. But the more complicated answer is that there is no answer because the state itself is in a big financial crisis. So there's not a whole lot of resources to go around. If we do get the state to um, a situation of better financial health, maybe there may be benefits to be had, but as of now, there's hardly going to be any benefit from that.
Yeah, and
In my
I feel
opinion.
that, yeah, I think every question I'm going to ask you has a complicated answer because there's so many layers to it. One of the pre-questions that we received is if enough commuters return to the CTA, can the agency use stimulus funds to avoid fare increases or service cuts, which I think you just touched upon a little bit about just the funding overall. And so the thought of having avoiding fare increases.
One of the things is that service cuts may have to happen, and that's probably there's no sugarcoating that. The transit is in a very unenviable position. This is my bias that is making me say this as a transit researcher and a transit buff that wants to see transit succeed. It's almost unfair. Right from day one, it's been compared against the automobile, which is a non-competition. And I say this in many of my classes. It's like the competition between the hammer and the nail. The hammer wins out every time, and so it's not fair for transit to be compared as a competition to automobile. It should be looked at as its own entity, and then that's the best way to stand it up because it does have a whole lot of merits. It has its own sweet spot where it provides great relief for very specific times of the day for core trip needs. It remains to be seen as to how those trip needs are going to change given the comfort that people have got in working from home, at least for the large section of population. There is still a core population that is dependent on transit in getting to work and back. So this all means that there is probably going to, and I'm talking about maybe the 5-year horizon, there may be an uphill battle for transit to rebound from the loss in ridership. And that may result in lower revenues. And in a time where there may not be another round of stimulus from the feds to cover operating expenses, in a time when the state's financial future is also somewhat uncertain, there may not be many avenues to turn to, in which case transit has to take care of its own. And the only way they can do is look at service cuts. And that may not be widespread. They may have to select and target it so that they don't lose the connectivity of the network for the core audience. So they have to be thinking through that, and then I'm sure they will work on it. But the short answer is there may have to be service cuts.
Which probably wouldn't be surprising, just given the complexities. Another question, could eliminating the 50% fare box ratio regulation be part of reinventing public transportation? I know I'm asking you crystal ball things.
It's yes and no. Um, Sometimes I wonder if the 50% is too low, because it lulls them into complacency. Not that I'm accusing them of being complacent by any stretch of the imagination, because when you look at transit across the world, most systems in other countries routinely, very routinely, make more than the operational expenses through the fare paying mechanisms. So the operational revenues that they get are greater than the expenditures in many cases. So then the question is, are we setting the bar too low? So that's my rhetorical self that is posing that question by 50% threshold. But at the same time, uh, there has to be other mechanisms. So one way to think about it is, if transit were to become less of a service provider and more of a mobility aggregator in partnership with the private sector, and figure out a financial mechanism that will work out, then there may be a better way forward. So this is hypothetical at this point. But the short answer is maybe the 50% is too low, in my opinion.
Thank you for sharing. Another question is, the shared mobility sector has already disrupted the taxi industry. With it eating away at public transit, should we increase taxes and fees on them?
It's happening. We should. It's happening in very specific cities. City of Chicago has a flat, what is that? The Uber tax or whatever it is called. It's in DC, in the DC area. They have a per mile tax for the shared mobility users, which I think is even better, because the longer you travel in those elements, then the more you pay as a tax. And then the best that I've seen is, of course, in Chicago and in DC, the monies that are received from that is funneled right back into the transit industry. So in the city of Chicago, CTA is the beneficiary of the Uber tax. In DC, it's the WMATA that is benefiting from that. So there's a whole lot of examples that are sprouting up around the country, and we need more of that. And then we need to think through that, because ultimately the goal should be very clear. What is it that you want to achieve out of this? You don't want to definitely penalize a certain behavior uh, to and then if you do so, then it has to be for the right reasons. And then the data from the shared mobility industry is very sporadic at best. We don't have as much of a granularity on the data front from the shared mobility users, so that it's hard to really judge who's using it, where are they going, how is it being consumed by time of day, what trip purpose. There's not a whole lot of answers there. So it's very, very unfair for me to say that, yeah, go ahead and tax the heck out of them and then give the money to transit, because unless the question is very well framed, the answers may be just misleading if you're not necessarily doing it for the right reasons. So my suggestion would be to make sure that you know exactly what you want to do with it before you implement anything.
And how it might change in our post-pandemic world too, that has to be taken into consideration. I think we have time for one more question. You had talked about the backlog before. So this person's question is, what is the $20 billion backlog at CTA, Metra, and PACE? And is the $17.7 billion in reinvestment for new trains, buses, and platforms?
It's so all of it is to improve the infrastructure. It's a fancy way of segmenting it. The $20 billion is things that the agency should have done over the last 100 years, for lack of a better time frame. The 17.7 is what they should be doing if they had been doing the routine oil checks over the next 10 years. That's what the oil checks will be getting them, costing them. So if that makes sense. So if it is taking care of track condition, if it is fixing a station environment or a platform environment, changing the light bulbs, for lack of a better example, that needs to be changed at frequent intervals. All of that needs to happen in the next 10 years is the $17.7 billion. What should have happened that didn't get done is the $20 billion.
That probably is a whole nother presentation as to why it didn't get done and where the priorities were. But thank you for the analogy of explaining the updating and maintenance. And when, to your point, if you have 50,000 miles on your car and you start to do an oil change, it's not going to not to take care of all the problems. Well, Dr. Shiraj, thank you so much for this wonderful conversation and for helping us navigate this complex world, really with transportation, particularly in Chicago, but across the country, and just as things change post-pandemic. We so much appreciate all of your time and sharing your knowledge with us, and are so glad that you've been at UIC for 21 years. That's fantastic, and among wonderful colleagues and faculty at Kappa. Just to wrap us up, please join us for our next Alumni Exchange program on Wednesday, April 7th at noon Central Standard Time, where we will be joined by an outstanding panel of alumni who will share strategies and wisdom for making career industry changes as mid-career professionals. To find a recording of this session and all of our past sessions, please go to go.uic.edu/alumni exchange. Also, be on the lookout for that quick survey that I mentioned at the beginning. We would appreciate your thoughts and feedback. Again, thank you, Dr. Shiraj, for all of this wonderful conversation and presentation today. Thank you to all of you for joining us. We look forward to seeing you in a future Alumni Exchange program. Happy St. Patrick's Day, and have a wonderful rest of your day.
Thank you all. Thank you for the opportunity. And then again, the UTC website address is listed right here. Contact Ed, contact us if there's anything we can do to help move things on or engage in a dialogue. We're always available. So feel free to reach out to us. Don't be strangers.
Thank you for sharing that resource. Yes, thank you so much. And I encourage you to do the same. Thanks again. Have a wonderful day.